Hi, my name is Naima Lawson, and today we'll be doing an IV insertion and removal video. The time is 3:22 and the date is November 29th. Before I go into my patient's room, I'm going to do hand hygiene. I'm going to provide privacy for my patient, and then I'm also going to gather all of my supplies. I have my tourniquet, my 22 gauge needle, my JP lube, my transdermal patch, the IV wipes, and then my IV flush and tape. Pause. So now I'm going to find my vein and where I'm going to insert my IV. I'm going to look for my vein. This one looks good. I'm going to put my tourniquet on. About 10 to 20 inches above. I'm going to check for it again. And then I'm going to loosen my tourniquet. Pause. Now that I found my IV site, I'm going to don my clean gloves because this is a clean procedure. I'm going to reapply my tourniquet. And then I'm going to clean my IV site with an alcohol wipe. Pause. Now that I have my clean gloves on, I've also set up my tape. I'm going to insert my needle, so I'm going to take the cap off of my needle, find my site, and I'm going to insert my needle 30 to 45 degrees. Okay, I saw a flashback, so I'm going to lower my needle. And then I'm going to eject it. Pause. Now that I have my catheter inserted into the IV site, I'm going to hook up my drain. And then I'm going to secure it. I'm going to use one piece of tape and I'm going to put it underneath. And then I'm going to wrap it around the butterflies, like so. And then I'm going to take another piece of tape. I'm going to wrap it over this part to secure it. Pause. So now I'm also going to secure this part to my patient. Then I'm going to place my transdermal patch. Place my tourniquet. I'm going to initial date and time that I put the IV in. Pause. Now that I released my tourniquet, I've dated my transdermal patch. I'm going to flush it. For video purposes, I wouldn't flush it, but in real life, I would flush it if I was at the hospital. I would unattach my syringe. And then I would let my patient know that they would be on the IV site for however long. And then next, I would remove my IV. Thank you. Now I'm going to remove my IV site for my patient. I'm going to gently release all of my tape, lifting up the edges. Then I would hold my gauze down and I would pull out the catheter. I would hold that for 60 seconds, applying pressure, and then I would tape it over. I would tell my patients to wait about 5 minutes before they take it off. I would also document that I removed my IV, the time, and if there was anything coming out like extra blood or anything like that. Thank you.